Good morning, everybody. I am Dr. Kalanidhi. I am a consultant plastic surgeon. I am doing my surgeries in VEECARE hospital, which is near Thirumangalam, Ananagar. Today, I wanted to dispel a few myths about plastic surgery. Plastic surgery is such a broad specialty that not only the common people, there are several doctors who are not aware about what are all the surgeries which come under the purview of plastic surgery. Plastic surgery can be broadly classified as cosmetic surgery and reconstructive surgery. Under cosmetic surgery, from head to toe, if you look at it, there are procedures called as hair transplant. Hair transplant is something which is done for baldness, where there is a frontal baldness, and if it is not too severe, the patient's own hair is harvested from the back of the head and replanted in the area where the baldness is most prominent. And apart from hair transplant, if you look at the other parts of the face, there is a surgery called as blepharoplasty. Blepharoplasty is a surgery of the eyelids. In elderly patients, there is a little bit of skin excess which sometimes obscures vision. So these patients are benefited by a surgery where the excess skin is removed and the scarring is very minimal or non-existent. The area around the eye heals very well where there is not much scarring. And apart from eye surgeries, we also have something called as rhinoplasty. Everybody would be aware of the fact about rhinoplasty because of the actress Sridevi, who had gotten it done, and the surgery has become very popular amongst a lot of people after this fact. And rhinoplasty surgery is something where when the nose is too broad or if the bridge is too large, they want the nose to become more beautiful. And the nose being the central part of the face is the most prominent and most visible part of any person's face. So any surgery on the nose will cause a dramatic difference which will be to the better for most of the patients. And this surgery involves where there is surgery on the soft tissues and on the bones. In elderly patients, there are some people who after 40 will end up with a lot of skin wrinkling on the face. So these patients will benefit from some surgery called as facelift surgery. The scars in a facelift surgery are masked behind the ear and within the ear, so the scars are not very visible. Similarly, in rhinoplasty also, the scars are made inside the nose, inside the nostril, so the scars are not visible. And facelift is a procedure where the skin and the underlying muscle are operated upon and made tense and taut, and it is made to give a youthful look. There are some patients want to have their lips surgery done because they have either too thin lips or they have too thick lips. So there are procedures where if the lips are too thick, we do something where we remove the excess parts of the lip and make it a little bit thinner. This is called as reduction kiloplasty. And if they want to make the lips thicker, we just inject either filler or fat into the lips, and this is called as augmentation kiloplasty. Apart from the face, the other parts of the body which have a lot of cosmetic procedures are the breast. And a lot of women have problems where they feel that their breasts are too small or that they are too large. If the breasts are too small, there is a procedure where there is called breast augmentation, where we implant a silicone implant under the muscle or above the muscle to make the breast size bigger. And this surgery can be done by making a cut in the inframammary region, below the breast or around the areola or through the axilla or through the umbilicus. So these are all the different approaches with which we place the balloon under the breast. And for people who have too large breasts, these people suffer from problems where they have complaints of repeated shoulder pain and skin problems because of constant rubbing of the breast tissue with the abdominal skin. So these patients will benefit from a surgery which is called as reduction mammoplasty. Reduction mammoplasty is a surgery where we make the breast size smaller, but inevitably it leaves a scar. So there is always a scar which is left behind, which will be extending from around the nipple and extending down like a keyhole. The appearance of the incision is like a keyhole. Ladies also would get commonly done a procedure called as liposuction. Liposuction, which is a procedure where the excess fat under the skin is removed using a tube with suction. And this is commonly done in adolescent boys who have larger breast tissue, which is called as gynecomastia. So these boys feel very embarrassed when they are going out in public where they have to participate in sports like swimming or any athletic events, they feel that their breasts are larger and they feel very depressed because of this. So these patients will benefit from liposuction or for their gynecomastia condition. And apart from that, the liposuction can also be done in the tummy area where the skin can be very thick. So some people have a tummy skin which is thin, and some people will have some tummy skin which is very thick. So for those people who have a lot of fat under the skin in the tummy region, they will be definitely benefiting from this. And liposuction can also be done for the thighs, for the arms, and very rarely for the neck and face as well. Most women after delivery experience something where they have something called as stretch marks below the umbilicus. These are called striae. And there is a surgery where we call as abdominoplasty or a tummy tuck surgery, where the excess fat along with the striae marks, about 80 to 90% of the striae marks are removed, and inevitably there will be a scar which will be extending horizontally in the lower abdomen. And if they have undergone a cesarean section, this surgery can be made where the cesarean section scar will be extended on either side and the surgery will be done. And apart from all these surgeries in countries like Brazil, where they are more cosmetically aware, there are surgeries which are done where they try to increase the size of the buttock and the size of the calf, because they give all these importance for all these areas as well, because people spend a lot of time in the beaches wearing bikinis. So these are not exhaustive, but these are a few of the cosmetic surgeries which are commonly done all over the world. I hope this video has clarified a lot of doubts which people might commonly have. And if in case there are any further suggestions, feel free to contact me through email ID or directly in person in my hospital. Thank you very much.